A lot of people are worrying about coronavirus. There's lots of incorrect information out there, so we're turning to our health experts to answer some common questions.
For most people, if you catch coronavirus, the symptoms will be mild. But for some, coronavirus could be very serious, especially for older people and people with health conditions such as asthma, diabetes, and heart disease.
We need to control the spread of this contagious disease in order to protect the most vulnerable people in our community.
What are the symptoms of coronavirus?
Coronavirus is a respiratory illness. If you're sick with the coronavirus, your symptoms might include fever, cough, sore throat, fatigue, shortness of breath. These symptoms are common to many other illnesses that don't necessarily mean you have the coronavirus. Most people will only develop mild illness and recover easily, but it's the older people and those with other chronic medical problems that are more likely to get very sick, and these are the people we need to protect.
What do I do if I think I have coronavirus?
If you are feeling unwell and think you have coronavirus, you should self-isolate in much the same way you would as if you had the flu. Don't go to work, school, or other public places.
If your symptoms are more severe or you have other chronic health conditions, you should call 13 Health and seek advice on what you should do next, which may include getting tested.
If you are seriously ill or are having trouble breathing, you should call an ambulance on 000 or come to the emergency department.
Depending on the severity of symptoms, some people might be admitted to hospital, while others will be able to go home to recover.
What happens when I get tested?
Medical staff wearing protective clothing will take swabs of your nose and or your throat. After that, you'll go home wearing a mask. You should stay at home and self-isolate until you receive your test results. It takes about 24 to 48 hours to get the results.
How can I protect myself and others from coronavirus?
The first thing to do is wash your hands more regularly. The more you wash your hands, the less likely you are to spread the virus to other people. Wash them before you leave home and after you've been out in public space or on public transport.
And we're not talking about quick splash under the tap. You need to really wash your hands. It takes about 20 seconds to get them really clean using soap and water. You need to wash all parts of your hands, not just your palms. This includes the backs of your hands and around the nails, in between the fingers and thumbs and wrists. When you're done, turn off the tap with a piece of paper or a tissue and put it in the bin.
Another thing you can do is to avoid touching your eyes, nose, and mouth, because that's the way that the virus can get into your body. Catching your coughs and sneezes will also stop the spread of the disease. Coronavirus can spread by droplets that come out of your nose and mouth. So when you sneeze or cough, catch it with a tissue and throw that tissue into the bin, and then wash your hands.
When you are walking around public spaces, avoid touching surfaces like handrails and lift buttons, etc. The less you touch things that others regularly touch, the less likely you are to catch the virus or pass it on. And remember to regularly wash your hands.
Another way you can protect yourself and others is to stay a safe distance away from people. If you're sick, especially with a fever, you should stay away from other people. The closer you get to someone, the more likely you are to catch something.
One of the best things you can do to stop the spread of disease is wash your hands.